Hello everyone, welcome back in the operating room. Today we're going to talk about surgical complications. Now you have seen before that kidney and pancreas transplantation are surgical procedures that need to be performed by an experienced team. Although efforts are always made to minimize the chance of complications in the period around the transplantation, these still may occur. Now, if you have the surgical procedure of a kidney and simultaneous pancreas kidney transplantation in mind, can you think of 5 possible complications? Please take a moment, press the pause and write them down for yourself. Well done. Let's now learn about the most common types of complications during and after surgery and how to treat them. During kidney transplantation, a number of problems may occur, and these are shown in the following video.
In this video, possible complications during kidney transplantation are shown. After reperfusion, there may be a problem with the inflow of blood. This could be an arterial thrombus, a kinking of the artery, or a dissection of an intimal flap in which the blood cannot flow into the kidney. There may also be a problem with the outflow of blood. Then, the kidney will get swollen and turn blue. This may be due to a venous thrombus, crushing of the outflowing veins, or a technical error in the venous anastomosis causing torsion or occlusion of the anastomosis. Of course, bleeding may also occur after reperfusion, from either the arterial or venous anastomosis, the vessels, but also from the kidney parenchyma. Finally, there is a small chance of leakage of urine from the ureter bladder anastomosis. This problem may also occur later, possibly due to necrosis of the transplanted ureter. Insertion of the double J catheter lowers the chance of urinary leakage.
Now, for all of these problems, immediate action is required. The anastomosis may need to be dis- and reconnected, or the kidney reflushed, and bleeding needs to be stopped. Apart from these complications, other events may occur that are not directly related to the transplantation itself, but are related to the procedure, such as nerve damage, bowel or other visceral organ damage, and cardiac or pulmonary problems. During pancreas transplantation, similar complications may occur. Due to the complex vascularization of the pancreas, bleeding may be more severe and thrombosis occurs more frequently. Treatment is essentially the same as with kidney transplantation. So after kidney transplantation, surgical complications may include wound infection, formation of a collection of lymph fluid, also called a lymphocele, leakage of urine, or a stenosis or tightening of the ureter-bladder connection. Some patients also get bowel obstruction because of manipulation during the operation. Later they may get an incisional hernia, which means that tissue bulges out of the incision in the abdominal wall. It depends on the severity of these complications, how they should be managed. Some patients will need a non-operative intervention, for example a drainage of fluid, or they may even need surgery. Complications in the period shortly after pancreas transplantation may also include wound infection, but more often intra-abdominal abscess due to leakage from the bowel anastomosis. Also, recurrent bleeding and thrombosis are rather frequent. Thrombosis may present itself by a sudden increase in blood glucose levels, which should therefore be monitored closely after transplantation. Urinary tract problems mostly occur in those patients where the duodenum is attached to the bladder of the recipient. In most cases, these complications require surgical reintervention, and they may lead to loss of the pancreas graft and in some cases even to death. So, what should we learn from this? In the first place, several types of complications may occur during and shortly after transplantation. An experienced surgical team and close monitoring are very important to decrease the chance of complications. Pancreas transplantation tends to lead to more complications than kidney, with sometimes more serious consequences. for the transplanted organ and also for the recipient. So now we know the basics of surgical complications in transplantation, but for those who want to know more about this, additional information is available. And of course, surgical complications are not the only challenges early after transplantation. In the next lecture, we will focus on other challenges, including delayed graft function and allograft rejection. Enjoy!